everyone. I'm Dr. Kim Nichols, board certified dermatologist and owner of Nichols MD of Greenwich in Greenwich, Connecticut, and Skin Lab Nichols MD in beautiful Harbor Point, Stamford, Connecticut. Welcome to the third episode of the Nichols MD Hustle and Glow Institute. I created Hustle and Glow for the reason that I want to educate those of us and those of you in the beauty business about how to attract, how to grow and gain and maintain loyal clientele. So these episodes have been curated by me for you with passion and of course profitability in mind. So today's topic is sell you, not the product. How to differentiate yourself in this ever commoditized aesthetic market. So basically today we're going to be talking about credentialing yourself. And remember, credentialing begins with having your passion, knowing your unique passion, expressing it to your clients and of course your staff so they can spread the word about it. And also making sure that the market knows your unique value. So where does that begin? So it starts with before the client even steps into your office, right? So it starts with your website. I said time and time again how important that is and how much material you have to have on it. Your social media, of course, and we'll get much more into that. And the minute that your staff answers the phone with a client who wants to know about your practice. So that's where the credentialing starts, and that's what we'll get into. But when they walk in, and you know, if you've seen my previous two episodes, you've seen our office, and I'm very proud of it, but things that speak to them right away. Videos that show you in different, media episodes. You'll see here that this video is scrolling with media appearances that I've been in, videos I'm doing in terms of different treatments that we offer. So really a great way to not only credential yourself, but also to educate the patient while they're filling out paperwork. And here again, the minute they come out of the elevator, we have more videos here and little snapshots that they can see. Also my skincare, so I represent one skincare company, and that shows that, that I value that one skincare line rather than just a bunch. And I think that really definitely helps with credentialing myself too in terms of the skincare piece. And as we go down, you'll see that, you want to have things that speak about you without you speaking too loud about yourself, right? So award placards that we have here. One little pearl is make sure that they're up to date. So this is a SkinCeuticals flagship here, just making sure that it's not an old one. We even use our beautiful restroom. We won't go in there right now, but we have placards in there, with various certificates and awards that show that what I've done, and also people in my practice and other providers. Here's another one here for the anti-aging medicine, which I think is great because it shows we're not just into cosmetics, but also anti-aging. Here are some more awards and placards as we go down, which are nicely displayed with a variety of, topics including lasers and also skincare and also, of course, injectables, which is my big thing here. And one thing you have, this is our checkout room, which was one of my favorite places, but here you have my mission, a statement articulated literally in words. We believe you deserve to look and feel your best today and every day. So again, the client's kind of walking through and getting that time and time again, that message. So if we come in here, just another thing, even as they checked out, again, we're seeing some awards and placards. And of course, really important, I think, is to know for your patients to know that you're involved in journal literature and that you're represented there in terms of writing different pieces about different topics, so they know that you're up to date and on the latest things. And as we come in here, here's a little bit more variety in terms of some of the articles and stuff that I've been in. One was Architectural Digest, which is one of my favorites, and it was actually not really talking about the procedures I do or anything like that, but really more about the decor of the office, which I was very proud of that they did a piece on that. And as we go through, you'll see some more awards and placards there. Something I'm also proud of, as those of you who know me or have followed us, I'm a proud mom of 3. Not only just an entrepreneur, and here was a Parents Magazine. I'm actually on the editorial board now, but a Parents Magazine article that we made into a placard, and that, you know, patients like to know that you're also, you know, a mother or parent. It just makes them feel, you know, closer to you. So we're about to get started with the didactic. So give me a minute and let's get going. All right, everyone. Welcome to the didactic portion. So today we're going to talk about, of course, sell you, not the product. How to differentiate yourself in this ever commoditized aesthetic market. Some disclosures to start. These are some of my disclosures. Please do not audio or visually record any part of the presentation. It will be available to all of you if you miss any or to watch again, which I hope you do, at kimnicholsmd.com/hustle and glow. So definitely look for that, and that'll be up there for you to look at the webinar again. Just a little about me. I'm a proud New Yorker, as I always say. I had my education on the East Coast and then did my dermatology residency at Harbor UCLA in LA, and then came back and started in New York City, and then came to Greenwich about 8 years ago and have been here ever since. And mainly with the mission of bringing the New York City luxury to Greenwich. You know, prior to that, so many of the Greenwich clientele were going to the city, you know, for their cosmetic services, thinking that was the only place where they could get sort of high-end luxury care. And so I came in sort of with that mission in mind to bring New York luxury here. And I think that we have succeeded, and we continue to expand and hope to do so in the future. But sticking to that mission, and we'll talk about more, has been vital to starting to credential myself when I began. So my philosophy, we've talked about before, this is my great team of women that represent us and do an excellent job. My philosophy is really about being natural. So, you know, that's one thing. We actually made a hashtag about it, natural at Nichols. And it's, again, something that we stick to and we say over and over again. And it really helps to establish that for our patients. They know even before they come for their first appointment that that's what I'm about and that's what they should expect. So a little data, which I think, especially in this post-pandemic era, is so important, you know, to share, because we're actually enjoying some record-breaking, you know, cosmetic statistics lately. I think a lot of it has to do with, you know, the Zoom effect, that people have been staring at themselves for 1.5 years on Zoom. So those clients that may not have been interested in cosmetic treatments before now are, because they've been looking at themselves for so long. We've gotten a huge influx of men because of that. And in addition, I think people, you know, deservedly want to take care of themselves again, having been, you know, stuck in the house or not feeling great about themselves for this whole time. So we really, across the board, nationwide, I've been talking to my colleagues in, you know, these meetings that we've started to go to again, and everyone is seeing the same upshoot in cosmetic treatments and such. So what we're seeing, so 64 million Google searches. Only 4 have been having those procedures. This is some Allergan data that we are sharing, but again, that's increasing every day. One of the #1 cosmetic pharmaceutical companies in 2021, the national average growth of accounts was 29%. Already this year, an average yearly growth is about 14%. For this company. And here with this company at Nichols MD, we average about 43% growth this year with their products and treatments. And this is compared to normal 21%, so literally doubled. A second leading cosmetic pharmaceutical company and product company has seen a national neurotoxin growth this year of 77%.
as compared to a normal in years prior of about 20%. And at Nichols MD, my practice, the same company and their products, we've seen 161.5% growth so far this year as compared to 30%. So really record-breaking numbers seen here on a national level and also in my office. So what about these new to medical aesthetic patients? So your millennial group, a lot of these are, and there's also some that are in, kind of the Gen Z, and also those who didn't get around to it before and who are maybe in an older generation, but again, because of, the pandemic are starting to sort of dip their feet into cosmetic treatments that they may not have thought about prior. So 67% are evaluating the quality of services at a practice, and 50% are seeking expertise and doctor recommendations. So this is huge, and this really goes to the credentialing that we're talking about tonight, because as a healthcare provider, you have to set yourself apart from, the rest of the quote unquote injectors out there who, might purport that they know what they're doing, but you really have to set yourself apart, knowing the anatomy and really bringing that to your patients so they know that, you're the one to go to as opposed to somebody on the block selling cheap Botox. 49% of patients in these surveys expect their appointment time to be honored, and 46% want a short downtime. A little bit about male aesthetic statistics. National average of cosmetic procedures for male patients is still low. It's only about 8%, but gaining every day. We actually have seen a big increase, like I said, in this kind of COVID and post-COVID era, and so we hope that will continue to increase. We now have about 15% of our patients are men. But there's one thing that gives us hope about the male market is that $345 million was spent by men in the skincare market in 2020. Now, a lot of this was in the shaving market, which is considered skincare. But again, you've probably seen it's really increasing in terms of men caring about their overall skincare and staying looking youthful and rejuvenated. So when we're talking about credentialing guidelines, right? So it's not just about showing your awards or displaying the articles that you've been in or the ones that you have written in journals and such. It must be trained. So what that means really is you have to know what you're good at. You have to be committed to ongoing learning. This is so important for yourself as the provider and also other providers and staff in your office. My staff learns, continually in terms of going to different conferences and keeping up with journals. We really make a commitment to it because if we go out there and credential ourselves to patients, we want to make sure that they know that we're not just doing this kind of as a one-time thing, but that it's an ongoing commitment to education and that we're staying on the cutting edge always. So again, know what you know, learn it slow if you're a new injector, for instance, and really become a master of those things, which we've talked about in some of my previous webinars, but really become a master before sort of taking on all these new treatments, because once you become a master at something, your patients will know that, will appreciate it, and they will, of course, spread the word. So again, very important in terms of those credentialing guidelines. And none of this works unless you're operationally strong. So, you could be the best at what you do. You could continue to keep up with learning, educating yourself and your staff. But if your patients are calling and the phone is ringing 5 times, or, you're chronically late to appointments, then all that work you went into is not going to mean a thing. So the foundation, of course, is an operationally strong business. And, I think that goes for all businesses, but especially this one, where patients have a lot more choice than they used to. So you want to make sure that everything is tight, as they say. And I think we're very much known for that at my practice. And I'm very proud of that we continue to make that a top priority. So the value of credentialing, I mean, I can't say it enough, especially in a market that's becoming increasingly flooded with people who say that they can do what you do. It doesn't mean that, yes, of course, people can get injections at various places, but it's your unique brilliance that brings your patients and your clients back to you over and over again and makes them refer other patients and their friends to you. So that's what you have to establish, and that's why they may pay more to see you, and they make sure that they tell everybody that it could be that, but it's because of a reason, and that's because of why, because you're unique in what you do. That's what we make a big deal about here at Nichols MD, and our patients definitely have drunk the Kool-Aid, as they say. So your mission statement, you cannot be replicated, of course, even though they might get different treatments that are the same somewhere else. And the benefits of credentialing, of course, are continual and exponential increased referrals, attracting the right patients. Oh, so this is very important. So you can't be everything to everybody, right? So in my mission, I talked about the fact that I was bringing New York City luxury to Greenwich and now Harbor Point, Stamford, Connecticut. And I stick by that. And that means that, that's the type of luxury care that I enjoy. And that's what my patients want to enjoy. And, that is a type of client and a patient that is looking for that. And that may not be everybody. Some people might want just sort of the quick in and out type of appointments and really, have a different look at how these treatments are done. So I'm not for everybody. I don't purport to be for everybody. So again, that uniqueness is valuable to myself and to my clients because they know that about me. Tenured patients, of course, is what you gain. We're proud to have a very loyal group of patients that continue to refer. Profitability, of course. Community recognition. I spend a lot of time in the Greenwich community in terms of some of my philanthropic investments and also in terms of the schools my kids go to. So again, really making sure in terms of credentialing that my patients know that I'm just not sort of a in and out business person, but that I'm actually part of their community and care about it. And of course, building strong aesthetic partner relationships. KOLs on a national, level. So as we said before, credentialing begins before the appointment. I love this one. So social media is very important. Everybody's on social media these days, and a lot of them are actually finding you on social media, which was not the case. We track our referrals very closely, and this has been a big phenomenon, especially in this sort of post-COVID era. So being creative, changing things up, being clear. I mean, one of the things here that you see is I sort of am showing some awards that I got, not just saying, hey, I'm award winning, but actually showing that New Beauty, in this case, had recognized me. And something that's also very important, especially to myself as an entrepreneur and a mother of 3 and trying to be in every place at once, it's so important in your social media and your website and everything that you do that you show that your partnership with your staff. It's very important. I have a number of physician assistant providers, medical estheticians. It's so important that we show potential patients and current patients that I believe in them, I trust in what they do, that they learn from me, that we all have the same mission, that I'm training them in terms of the different treatments that I do, because I can't be in every place. I can't see every patient. If I want to grow this business, it's important that potential patients know that they can see other providers in my office and feel just as comfortable because of this team that we've got here. So again, super important to show that even before the patients come and walk in the door. And providing your staff, especially your front staff that are answering the phones all day or answering emails, with good credentialing phrases that they can use even when they're talking to patients that are thinking about making an appointment. So something like concrete, like we do 3 to 4 therapy treatments a day. I mean, things that really hit home so that patients know that it's not just about what we're saying we're doing, but is actually what we're doing. So really giving them a list of those credentialing phrases that they can use on those appointment calls. And office design, of course, we went through this when I was walking through the office before about all the various tools and AV and media that you can use. Very important, of course, are true before and afters, which you'll see on all of our exam rooms, on the TVs, scrolling videos of our before and afters. This is by far the most powerful selling and credentialing thing that we do here. It starts, of course, on our website, on our YouTube. Patients, by the time they come, often have gone through all of them already, and it's simply, really gets the appointment going from the start in terms of the consultation, because they already see, concrete examples of the work that we do and that I do, and they see it on real people their age, people in their, sort of ethnic demographic. So again, the most important thing is for you to have a ton of different varying before and afters of your real patients. And important is making sure that they see that these are patients that were treated not just by you, but also by your other providers, going back again to credentialing the whole team. And during the appointment, I spoke a lot about this in my previous webinars, which again, if you haven't seen them, please definitely check them out on our website. When I was talking about how I do a consultation, how I, sit down with a patient with photos of themselves on the iPad and really go through a full assessment, they see immediately that I'm not taking sort of a cookie cutter approach in terms of using phrases like, oh, units, or we're going to use this many syringes. They really see that in terms of my education and my training, that I'm taking their whole face into consideration, their whole neck, their whole body, in fact. And again, that really shows them right off the bat during the consultation that I am unique in the way I approach how I'm going to treat them and get them to look their best and look their most beautiful or handsome and look their most confident, of course. And reviewing the photos that we look at on the iPad is also a chance to show them, of course, how aging has happened, things that I can do. On that iPad, we can also look at some of the before and afters that are, particular to the treatments that I'm recommending for them. And I make sure that I explain all these things before we start everything. Again, you never want to be sort of halfway through injecting a patient and explaining, what they should expect or what you're doing. So again, super important to do right away off the bat. And it also makes them feel, in terms of the credentialing piece, it makes them feel safe. It makes them feel that they're in good hands. It makes them feel that you care about their safety and their downtime and all those things, not just about, getting, their money after doing these cosmetic treatments. So again, that's all part of that initial consultation, sort of building that trust with them from the bat that will carry on in the future. So I'm so excited because after this, we're gonna break for a couple of minutes, and then we're gonna have the live injection. And the live injection today is gonna be about Tech Neck. And you'll see here, I published an article, a case study about 3 of my real before and afters of patients that we treated with Tech Neck, which is a combination treatment, which sets me sort of unique in terms of how I approach this problem, and we'll talk more about what that is. And again, there was a video that New Beauty did on us and on me actually injecting and talking about Tech Neck, which is on my YouTube and our website for patients to view prior to their appointment, or even if after their consultation when they're thinking about it. So hint, hint, that is, how I just credentialed myself regarding Tech Neck. So I hope you enjoyed this. We're about to do the live injection. So I will see you in about 5 minutes. Thank you. Welcome back, everybody. This is the live injection treatment that we're going to do today, which is about Tech Neck. So what is Tech Neck? How are you today?
I'm well, how are you?
Good. So tech neck is really the horizontal lines, I know you've seen them, and skin laxity that we're starting to see in patients younger and younger and younger. And why is that? It's because we're all looking down at our phones. Statistics show that millennials look at their phones up to 12 hours per day. I don't know how that's even possible, but it's true that even non-millennials, we're checking our phone at least 69 times a day. So you can imagine over time, this is going to cause a lot of issues in terms of lines and also looseness of the skin. And gosh, now with COVID, with people staring at Zoom all day long, this has become huge. We're actually getting a ton of client interest in treating the neck because they're staring at it now all day long on Zoom. So how do we do it? Well, this is really, again, what sort of sets me apart in terms of credentialing that we were talking about prior, because this is a combination treatment. You'll see that we're going to be using 3 different modalities to get the best improvement for this issue, and we're going to be doing it all in one appointment that literally takes less than 40 minutes. And it starts with micro-focused ultrasound energy, and that's the device that we're going to start with today, which really is going to help with giving that thermal energy that's going to induce collagen and tighten some of that skin laxity over time and give longer term effects. And we're actually going to treat the model's entire sort of submental area and the neck. Now today I'm going to just treat a few lines just to show you what I'm doing, so for the sake of time for the webinar, but we treat the entire area in about a 10-minute treatment with the microfocus ultrasound energy. And then we're going to proceed with a neurotoxin. So a neurotoxin around these horizontal lines. We're going to inject that around, again, of course, to relax this movement of the up and down. She'll still be able to look at her phone and she won't be stiff, but again, that's just going to relax that movement a bit. And the third component that we'll end with is a dermal filler, a superficial one, that you'll see I inject in sort of a bleb technique, and that's going to be what's going to help to fill the actual lines themselves. So it's the combination of all those things that gets the best result. And when my patients come for a consultation about it, or something that I bring up to them, they really like the fact that we're hitting it all different sides. So for instance, if we were to use the dermal filler without relaxing with the neurotoxin, and I just explained to them, it's just going to get eaten up and really not give them much value in terms of results. And they really get that. So we'll get started now. My lovely assistant, one of my physician assistants, Vanessa, is here to help me out today. So we're going to start, like I said, with the microfocus ultrasound energy treatment. Again, I'm just going to show you a few lines just so you can see, but really to make the point that even this is, you know, again, not a cookie cutter treatment. We're really looking at the model's anatomy, seeing where right here you can see her 1.5 depth is a great place to hit here. And I want to address not just the skin on the neck, but also in the submental area, because again, this is all part of that lower face tightening. And we would continue this for a number of lines for about 10 minutes or so. How was that?
Good.
Good. Afterwards, I'll have Vanessa finish the ultrasound. All right, now we're going to do the neurotoxin treatment. So Vanessa, I'll take a little gauze just to get off the last bit of the little gel with the microfocus ultrasound. Great. And you can see here that our model, who's also in her 20s, so a really good, important point to make is tech neck is a treatment that's not just about the aging skin. You know, again, this is something that we're seeing in patients younger and younger, literally because of how they're looking at their devices. So important that you hit a large demographic, and some people will want to start getting this treatment early because of prevention. And prevention is a huge factor for, you know, the younger population, because they don't want these to get deeper and deeper to the point where they become sort of etched in and very hard to treat. And as we all know, you can you know, necks are huge now because of the Zoom and everything else, but they were starting to get big already because people are realizing they've been taking care of their face, they've been using the right skincare products. But if the neck is not in continuum with the face, you know, it kind of, shows people right away in terms of the age factor. So again, really paying attention, you know, to the neck is important too. All right, so let's get started. So we have a neurotoxin here, and you'll see the way that best treats these horizontal rights is doing it sort of in a zigzag technique where very superficial, blebbing the skin. I tell the patients to expect to see these little blebs, you know, for an hour or so before they go down, but it's really the best way to treat very superficially. In terms of the muscle movements around these lines in the platysma. How are you doing?
I'm good, thanks.
Good. And you'll see this sort of zigzag formation tends to get a great result. Her strongest lines, of course, are her two superior lines, but I don't want to forget the inferior line here. So you'll see I will address some treatment there. Good. I'm going to have you turn for me. Zigzagging along. Again, we almost kind of lose that bottom line. She doesn't have much at all, but I will do a little bit here. Right, and a little bit left of the neurotoxin little injections. And one thing I explain to patients is for the first few days, they might feel with the neurotoxin setting in, they might feel like when they come off their pillow, their head's a little heavy. That's nothing to worry about, and that'll, of course, go away. I'm going to turn a little bit more towards me. Just, yeah, perfect. Almost done with this part. Again, zigzagging. You know, you warn patients they can get a little injection mark bruise that we could, of course, you know, zap with the bruise laser or something, or use some arnica cream. Definitely, they appreciate that. Perfect. All right, so now the third, you can see how fast that went. So you add that to the microfocused ultrasound treatment of about 10 minutes, and we're still only at about 12 to 15 minutes. And now we're gonna do the injection of the dermal filler. So such a quick treatment for wow results. And with this one, you wanna go very superficial too. Yeah, you actually perfect, just like that. And these little, you know, sort of blebs, I explained to her that to just, you know, kind of let them get into those superficial lines. You know, you'll be tempted to say, oh, let me push those down, but it really needs a day or two to get into those lines. So it's important, you know, to explain that to the patient, obviously prior, so they don't think that anything's wrong. And that this is all part of getting the best result. And Cass is being very brave now. I know it's hard to be still with this injection. You know, it has lidocaine in it, but she definitely is going to feel it. Now, we've numbed her prior, though, so it's actually not that bad. We did numb her for a good hour prior. Not all my patients will numb for this treatment. You know, so it's, again, up to them, just to give a little bit of less discomfort, especially during this last little piece with the filler injections. Good. And I'm actually going to come around. So again, I've always talked to you guys about making sure that you, the injector, is comfortable when you're injecting. And that'll serve your patient well in terms of results. And again, I'm focusing most of my injections on these top two rhytids. Almost done. I explained to patients that, with the hyaluronic acid filler that I'm using, this is also in the preventative, kind of story, because hyaluronic acid actually induces some collagen production. So even after the several months that it goes away, she'll still have an improvement in terms of, how the lines look and the building of the collagen. And you combine that with theotherapy and you get those longer lasting results. It's not just a quick one-time thing. And this is a treatment that I tell patients they'll probably have to do twice a year. Sometimes a little bit more often in terms of the neurotoxin component, but twice a year is the most common. Awesome. You did great. So we're going to clean her up. Although right now, you see the little blebbies and everything else, in a few days, it's going to look great. And about a week to 10 days, she's going to have her full result. And we'll bring her back for a after photo that we'll show on the website and show to everybody. So thank you guys so much. I know some of you may have had some questions, so we'll finish up the injection here and we'll answer some questions before we finish out.
So Dr. Nichols, somebody had asked, how do you bring this up to patients when they don't bring it up to you?
Great question. So, one of the things I do, and that's kind of part of that full consultation, and again, why patients come to me as opposed to somewhere else, because a lot of them expect me to bring up other things. That's why they came to me as an expert. They didn't just come to me just for the Botox, as I say. They're not just coming for the Botox. So you really have to make a full assessment. And I tell them, look, these are things I'm seeing, may not be a priority for you, but this is something that, I just want to explain that we have a really nice treatment for. I'm going to put it on your client plan just to explain it more. Here are some videos on our YouTube so that you can learn about it. And just, again, get their interest going about something that they might not have considered. And I'll tell you, 9 times out of 10, it ends up being something, because I brought it up down the road, they remember that and they end up wanting to do it. So again, they're coming to me for a reason that I'm not just taking into consideration what they're thinking about. It's the same as, when you talk about, the patients who come in, we talked about earlier on the previous episode about syringes versus, looking at the full face in terms of filler packages. The patient who comes back and says, I just want my smile lines done. Your job as an expert is to talk to them from head to toe about what causes these smile lines and how you're going to approach it.
Great. And somebody else had asked, although Tech Neck, the 3-step protocol is the same, how does it really vary between somebody who's older, maybe in their 60s, for somebody who's younger, maybe in their 30s?
So, and that really depends upon, when I'm looking at the patient in terms of different ages. So for instance, we might be doing the same 3 things in the combination treatment, but for the older patient, I might do more of the therapy part or the microfocus ultrasound part, because I need some more skin tightening there than I would need with a patient of Cassie's age. So that part of it is really up to the provider to tweak and to use their understanding in terms of the treatments. I also may need more filler with, for instance, a male patient, who's got much deeper lines, who needs more neurotoxin, again, because their muscles are bigger and need more of that for relaxation.
And another question came in. So how can you further prevent Tech Neck? Are there behavioral changes, or is there a specific skincare product or ingredient that you'd recommend for Tech Neck?
Well, behavioral changes are tough, because I'm going to tell you to stop looking at your phone all the time. And I know it's very hard for people to do, especially people in their 20s. But I love putting away my phone at night, actually. But anyway, another thing you can do is try to kind of lift it to you. I know it sounds kind of dumb, but it's true. So really practicing, I know this came out with Zoom, positioning the computer better, especially for people who are unfortunately on Zoom for 8 hours a day for work. Same thing goes with your phone. Really try to kind of keep your neck up and look at it like this instead of looking it down. I know it's going to take some time to get used to that, but that can definitely help. And of course, neck products are a big thing, and neck products using an ingredient called retinol that I know you all know about. But retinol, you know, for a lot of patients, you have to kind of educate them that it's appropriate for the neck, because oftentimes they think that their neck skin is too sensitive for retinol, and it actually needs it more than anything, especially with the crepiness and the laxity, that chicken skin that people always complain about. So using a product with retinol on the neck is very important.
And another question came in about how do you learn such off-label techniques? Where do you get a lot of your knowledge from?
It comes from all different places, and I'll be completely honest. So everything from meetings to webinars my other colleagues do. I'm literally picking up stuff all the time and putting it together. Some of the stuff that I put together really comes directly from what other colleagues are doing, or of course from the literature. But sometimes I'm tweaking it to my own unique way of going about things. But I'm gathering information constantly. Another great thing that I do, where I get a lot of my info from, is from, oh wait, let me show her. So from my great physician assistants, we actually do meetings together twice a month, where we come in an hour early to go over some of the latest literature and journal articles. And they, you know, I stopped actually giving them the topics to research. They now bring the topics to me, because they're you know, on the latest thing on social media and everything more than I am. So again, drawing it from all different sources and knowing that you're not the only expert out there, and really putting that all together into these combination treatments.
And then lastly, everyone wants to know, so this is your last episode of Hustle and Glow. Where can they learn more? And do you have any exciting things around the corner about Hustle and Glow?
Yeah, so it's not our last. It's our last for this series of 3. We're actually going to be coming back in the fall, so definitely look out for that. But for those of you who want to review some of the previous 2 webinars, or this one, of course, please, and send it to friends and all those things, go on our website, and you'll find there at the top Hustle and Glow, where you can put in your email and get those webinars to view. And also those of you who registered, you'll be getting an email from us probably in about 48 hours, making it available for you to watch the one tonight again.
Awesome. That's it for questions, so thank you.
Awesome. Thank you guys so much. Thank you for those of you who tuned into all 3 webinars, and we will see you again in the fall. Have a great rest of the summer. Bye.